Hello, this is the Oral Health Care for Individuals with Developmental Disabilities, Tools and Techniques for Caregivers. My name is Dr. Louisa Utset Ward. Introduction to Oral Health Considerations for People with Developmental Disabilities. This presentation is intended for an audience of caregivers, that is, people who are not health professionals, but who care for children and adults with developmental disabilities. The presentation will cover the main topics of importance for good oral health, such as causes of oral health problems and suggested remedies, the basic principles of performing preventive oral hygiene, positioning tips, strategies for adapting home care devices for use by persons with physical limitation, and managing challenges to practicing effective oral health home care. Also, we will discuss how to recognize healthy and non-healthy oral conditions, distinguishing between when the situation may require urgent rather than non-urgent attention, and also on establishing a dental home. It is widely recognized by national advocacy organizations and others in the health profession that people with disabilities or complex medical conditions and those who are homebound are more likely to have dental disease. A disability may require changes to be made in the person's oral hygiene routine to allow him or her to properly clean his or her mouth. For example, a developmental disability such as intellectual delay may make brushing and flossing techniques difficult to learn and do. A sensory disability may require using pictures and visual prompts to learn to brush and floss. Other people with sensory disabilities, such as those who are visually impaired, may learn better with auditory cues. People with poor muscle control, such as cerebral palsy, may require that another person perform the daily oral hygiene. Neurologic or communicative disorders, such as seizures or Alzheimer's disease, may make it difficult to maintain a clean mouth, teeth, and tongue. Pre-existing conditions may make it necessary to change the way we approach oral hygiene for each individual. Some conditions that make oral health care more difficult include the following: the limited ability to understand instructions, which means that the directions should be given in simple, clear statements without using unclear or confusing words. Behaviors that may interfere with treatments, such as self-injurious behaviors or being aggressive towards the caregiver, will require special techniques to protect both the individual and the caregiver. Poor control over facial muscle movement and some unusual reflex movements, such as seen in persons with cerebral palsy, require an awareness of which positions are best for the individual and the caregiver. Caregivers must be familiar with adaptive devices, such as wheelchairs, and know that they can be used as dental chairs if the individual is unable to transfer to a dental chair. It's important to be aware of the medicines that a person may be taking. Certain medicines may have a lot of sugar and cause cavities or dry mouth. More frequent dental visits or special therapy may be required in these cases. Complex medical conditions such as respiratory problems or individuals with breathing tubes may need shorter dental visits and access to suction devices. Good oral health care is a key component of general health and well-being. It is well documented that there is a direct link between gum disease and certain types of heart disease, obesity, and diabetes. Oral health affects behavior and may cause behavioral changes. Tooth or mouth pain can cause an increase in aggressiveness towards staff, peers, and family. It can also interfere with eating, chewing, and proper nutrition. A pleasing smile, pleasant breath, and nice appearance help to create a positive reaction from others around the person with a disability. Individuals with bad teeth and bad breath may find themselves avoided by others or teased. Speech can be affected by the loss of teeth. Teeth are necessary to make proper sounds and to speak clearly and well, especially the front teeth, where we place our tongue against the front teeth in order to make many sounds. Comfort is important, and an unhealthy mouth may cause pain from dental cavities and gum disease. Proper nutrition may be affected if tooth loss interferes with the individual's ability to chew comfortably. Bad breath arising from poor oral hygiene makes it less easy for the individual to interact with others. Now let's talk about the characteristics of a normal appearing healthy mouth. This is our goal, a healthy mouth which is free of pain. The gums or the gingival tissue are pink. The gums don't bleed when the teeth are brushed. There's no dark spots on the teeth, which are cavities, or maybe cavities, or broken teeth. The mouth simply looks healthy. Now let's look at both of these pictures. They look quite different. The picture on the left is an individual of how the mouth looks in a healthy white Caucasian individual. The picture on the right shows the mouth of a healthy Black or African American individual. The difference is the pigmentation or dark coloring of the gums, and this is simply quite normal. Healthy gums don't bleed when teeth are brushed. Quite simply, if the gums bleed, there's a problem. Gums are coral pink or brown and usually lack red areas, which may indicate areas of gum irritation or inflammation. The gums are tight and firmly attached to the underlying bone. The gums often appear dimpled, quite like an orange peel. When the gums are unhealthy and swollen, that dimpling may disappear as the gums are stretched. Now let's talk about abnormal conditions and causes in the mouth. This is an example of what unhealthy gums may look like. The slide to the left demonstrates irritated, inflamed gums or gingivitis. Plaque, which is a film which forms on the teeth. If you take your finger and you scrape your teeth, you might find some white, yucky material. That's plaque. Plaque is made up of food particles, bacteria, and saliva, which remains on the tooth surface after eating. Tartar, also called calculus, is actually plaque that has hardened onto the teeth, especially around the gum line, and this usually occurs due to the minerals in the saliva. Both plaque and tartar make the gums irritated and inflamed. Gingivitis is a condition when the gums bleed easily. The borders where the gums and the teeth meet may look red. If the teeth are clean and plaque and tartar are removed, the swelling and redness go away. Gingivitis can be stopped from getting worse and its effects can be reversed. So gingivitis is reversible. The picture on the right, though, demonstrates gum disease or periodontitis. This is an extreme case. It shows the loss of bone around the tooth and especially the roots. Bone loss has occurred due to unstopped gingivitis. The teeth may appear longer. There may be spaces between the teeth that were not there before. Teeth may become loose. Plaque and tartar may be visible, and there could be draining pus. What's important to note is that periodontitis is usually called a painless disease. It's not really causing any pain until it's very severe. The damage of periodontitis is not reversible. Unhealthy gums bleed easily because they're irritated and inflamed. It's kind of getting a splinter. Once you get the splinter, the tissue around it starts getting red and puffy, and if you push on it, it can usually hurt. The gums are swollen. This is because the enlarged blood vessels bring in more blood to the area in order to fight the germs in the plaque. It's the plaque that covers the teeth and contacts and irritates the gums. Unhealthy gums that are inflamed by plaque or tartar or calculus may initially bleed when brushed. Teeth should be brushed well, even though gums may bleed easily at first. Brushing the teeth regularly and thoroughly will usually eliminate and reduce the cost of bleeding. Pus may be draining from around the tooth due to a localized infection. Now, you may experience any of these stages. What causes gum disease, you may be asking? Both plaque, which is soft, and tartar, which is rough, irritate the sensitive gum tissue. The body's response to tartar causes the underlying bone beneath the gums, which supports the teeth, to dissolve in order to reduce the contact with the irritant. It's trying to get away from it. Some medicines, such as sleeping aids and drugs that help to calm behavior, may reduce the amount of saliva produced in the mouth. This allows the plaque to attach more firmly to the teeth because the saliva is not there to help clean the teeth. Drugs such as some medicines that prevent seizures may cause the gums to overgrow. Other medicines have a high sugar content which can result in an increase in cavities or dental caries. What causes cavities? For cavities to develop, 3 essential ingredients must be present: a plaque-covered tooth, bacteria, or sugar. If any of these are missing, you can't form cavities. If you don't have a tooth, it won't get a cavity. If you don't have bacteria or the sugar to feed it, you won't form a cavity. The bacteria produces an acid which dissolves the tooth surface, leaving the cavity. A cavity is simply a hole in the tooth. If the plaque is brushed away, the cycle is broken and there will be no decay. Cavities in both primary or baby and adult teeth must be treated. Once a cavity is formed or a hole, it won't close itself. Gastroesophageal reflux disease and habits like regurgitation can damage teeth and can lead to decay. Other than tooth decay caused by bacteria, teeth may suffer damage that makes them more likely to become decayed. GERD, or gastroesophageal reflux disease, or reflux disease, is one of these habits or problems that can cause increased likelihood of decay. For this presentation, we will divide GERD into involuntary and voluntary occurrences. Involuntary reflux occurs when there's a backward flow of stomach content into the esophagus, the tube that connects the stomach and the throat, and ultimately into the mouth. This can happen when the valve between the top of the stomach and the esophagus is weak or spastic. It means it doesn't close properly. Eating a bland diet and not laying flat in bed after eating can help avoid this problem. There are medicines which can help counteract and neutralize the acidic content of the stomach. Persons who show signs of GERD should be offered water frequently, either to drink or to rinse, in order to help neutralize the damaging acidity. Remember, acid is what causes the mineral of the tooth to be worn off and to form a cavity. As previously explained, there's also a voluntary process which brings stomach content out of the stomach through the valve and back into the esophagus and possibly the mouth. This is called rumination or regurgitation. The results can be extensive damage to the tooth enamel, making the teeth more easy to decay. This can be present in individuals with autism or other types of developmental disabilities. It is a habit from which the person gets stimulation or comfort. These persons chew, regurgitate, and re-chew. This may occur over and over again. It may be when they are alone or when they're anxious. Sometimes they might even store food in their cheeks. Behavioral interventions can benefit these individuals. Some of you may have experiences with persons who store food and pills in their cheek. These habits are seen frequently, and direct care staff and families should be reminded to inspect the mouth and take actions as recommended for those people known to do this. When pills are stored or pouched between the teeth and the cheek, they can cause chemical burns to the gum and cheek tissue. The best solution is to offer the person additional water to drink. If the water doesn't dislodge the pill, a sweep of the mouth with a gauze-wrapped finger will do the trick. Make sure that you keep your finger between the cheek and the teeth, not in between the teeth, so that you don't get bit, because it's very, very difficult to force a person to open their mouth once they're biting. And one of the little tricks is you can sprinkle some water in their eyes, and that'll cause a reflex where they will open their mouth and let go of your fingers. The best thing to do is avoid being bit. Pouched food can be removed the same way. Habits such as grinding, clenching, or gnashing the teeth, which we call bruxism, can take place at night but can occur anytime. These habits may occur from stress. Picture yourself traveling to an appointment. You're already late, and then you get caught in miserable traffic. You may find yourself clenching your teeth. You might even start getting a headache from pressing the teeth so hard or grinding the teeth. People with autism may clench their teeth or grind them. It relieves tension, stimulates them, and gives them comfort. Individuals with cerebral palsy may have involuntary teeth clenching and grinding. This is due to their neuromuscular condition. It may result in the total flattening of the chewing surface of their teeth, reduce the length of the front teeth. They can actually grind through the first layer of the tooth, the enamel. The enamel is kind of like your nails or your hair. They don't have nerve endings, so that's why you can eat and not experience pain. The next layer of the tooth, the dentin, actually has nerve endings. So if a person wears away all of their enamel, the next layer of the tooth that's exposed, the dentin, will cause a lot of sensitivity. If the person who grinds his or her teeth cannot be redirected to stop this damaging behavior, a dentist might be consulted to consider creating a bite guard appliance, which may help avoid damage to the teeth. The person must be cooperative and willing to wear the appliance for it to have successful results. Sometimes, in extreme cases, we can actually add a little bit of white filling or composite strategically to some of the outside surface of some teeth to help dislodge the teeth during grinding and protect the other teeth. Self-injurious behavior is a frequent habit of people with developmental disabilities, including autism. It can occur when individuals are anxious, frustrated, frightened, and even when they're extremely happy. It can be harmful to the teeth, the hair, and the skin, depending on the behavior. All efforts must be made to redirect the behavior. If the person gets positive reinforcement, she or he can sometimes be encouraged to choose a different behavior, and the self-injurious behavior may present itself less frequently. Sometimes something is simply giving them something else to hold or squeeze. If your efforts to redirect behavior are not as successful as you would like, a behavior analyst may be able to help. Sometimes something as simple as wearing soft gloves can reduce or eliminate picking and scratching behaviors. This could be prescribed for the person by the medical or mental health provider or by a behavioral specialist. The most frequent cause of bad breath is poor oral hygiene. It is the caregiver's responsibility to carefully monitor the oral hygiene of the individual being cared for if that person is brushing his or her teeth on their own. If there is food or plaque left on the teeth, especially at the gum line, the person should be encouraged to rebrush the teeth. You can use disclosing tablets or solutions that are sold at the drugstore, and that'll make it easier for both you and them to make sure that there's no plaque left on the teeth. Other causes of bad breath are dry mouth, which often is a result of mouth breathing or a side effect of a medicine, sinus infections, digestive problems, diabetes, and deeply fissured tongues that can hold food material in the grooves. In most cases, improved oral hygiene can help reduce bad breath. If the caregiver's responsibility is to provide the oral hygiene for the individual in his or her care, then it's also the caregiver's responsibility to do the job thoroughly. And we'll go a little bit into how to brush the teeth in a few slides. I hope that some of you have used tongue scrapers. It's a very good cleaning aid. A lot of the bad breath and bacteria collects in the tongue, especially overnight, kind of like that morning breath that we have heard about or we have experienced. And this can be easily cleaned by using a tongue scraper. The use of a tongue scraper is a lot easier than using a toothbrush. A toothbrush usually makes a person gag, but using the tongue scraper, the gagging reflex is decreased. It's important to understand that when an individual has a feeding tube, the mouth is no longer experiencing chewing, and as a result, there's little or no oral stimulation. The actual act of chewing causes a sort of self-cleansing of the teeth, gums, and tongue. Though there might be little plaque present on the teeth, there's often huge deposits of tartar or calculus. This happens when the minerals present in the saliva turn the soft plaque hard. Also, these individuals often breathe mainly through their mouth, which can cause dry mouth and increase this likelihood. Teeth, gums, and tongue must be brushed at least twice daily for patients on gastric or G-tubes. If the individual has what appears to be a dry mouth, the primary physician or the dentist should be contacted to see if the dry mouth is present due to specific medicines being taken. Sometimes the medicine can be changed to one that doesn't result in these side effects. A dry mouth may interfere with chewing and swallowing, may make speaking difficult, and may be painful. Sometimes something as simple as chewing sugar-free gum may increase the amount of saliva present in the mouth. If the person has swallowing difficulties, he or she must be able to chew without swallowing the gum. The primary physician or dentist should be consulting regarding the appropriateness of this. Saliva substitutes are also available. They may be liquids, gels, or sprays. They may be used to moisten a dry mouth. Consult your dentist about the possibility of using saliva substitute. Many of these are over the counter. Healthy teeth. This photo illustrates what healthy teeth should look like. There's no discolorations or cavities, holes in the teeth present that we can see. The gums do not bleed when the teeth are brushed, and there's no bad breath from the teeth or gums. Here are some examples of unhealthy teeth. These are very extreme cases. What's really important to note is that there's a need for regular visits to the dentist because we want to find these cavities or holes when they're very, very small, often not visible to the untrained eye. So these photos show advanced stages of cavities or dental caries. There are visible holes, dark staining, and broken teeth. If a caregiver notices anything like this, a dental appointment should be made immediately. It is possible there could be infection present with swelling, known as a dental abscess. Pus may be even coming out, or a little blister or fistula forming in the gum tissue around the vestibule of the gums. Prescription antibiotic medicine may be required to eliminate the infection temporarily, but dental care will be needed to prevent the infection from returning. What we want to do is avoid these drastic cases. Now let's talk about how to achieve good oral health. There's 4 steps to a healthy mouth. These include brushing the teeth twice daily, in the morning and at bedtime, especially at bedtime because there's a very long period of time with decreased saliva that occurs as we're sleeping. Using a toothpaste that contains fluoride, which strengthens the tooth enamel, is important. Brushing removes the plaque from the teeth, gums, and tongue surfaces. Caregivers should do a quick check of the mouth to look for and report any changes. So make sure you pull the lips up or down, depending on which arch of the mouth, and look for anything that's unusual around the gum. Brush the top rough surface of the tongue or use a tongue scraper. We talked about this a little bit. The toothbrush is very difficult to use to clean the tongue. The tongue scraper makes it a lot easier. There's a lot of different types of tongue scrapers in the market. I don't like the ones that look like razor blades, but the ones that look more like a loop are usually better. Floss every day if possible. Flossing removes the plaque and food substances that are stuck between the teeth where the toothbrush cannot be reached. If the person has no difficulty with rinsing their mouth or spitting out, the use of a water irrigator or water pick can also be used. You will see these brushing and flossing procedures demonstrated in the video segment. Visit the dentist regularly. Every 6 months is a common interval, but visits may be more often or less frequently as recommended by your dentist for the individual patient. Ask yourself, where do you usually provide the oral hygiene? Is it in the same place, or do you go different rooms, different places, different days? Having a routine is important for individuals with developmental disabilities. Home care is best provided at the same time every day when both the caregiver and the person with the disability are not stressed or rushed. The consistency and routine is important. Oral hygiene should be done in the same place and every time. If possible, the same person should be the one providing this care. Oral hygiene should be provided in the most comfortable and convenient location for the brusher and the person whose teeth are being brushed. If the person's bedridden, the head should be raised to a 30-degree angle to reduce the possibility of aspiration or accidental breathing in of material from the mouth. When preparing to perform oral hygiene, it's really important to have all the necessary items within easy reach. You don't want to have to stop what you're doing and get something that you forgot and then start again and then go back and get something else that you forgot. Always use a brush with soft bristles, whether it's manual or electric. I prefer electric toothbrushes whenever possible, but we'll go a little bit into that a little bit later. So how do you store the toothbrush after they're being used? If the person's in a group home, the brush is often stored in a travel case or a cup with a cover on it. Bacteria tends to grow in a moist place, so the brush should be allowed to air dry prior to storing it, or the storage device should have like holes that let the air go through. When do you change the brushes? The brushes should be discarded and replaced frequently, usually every few months. When the bristles become worn or rough looking and spread apart, or after a sickness. What actually cleans on the toothbrushes is the very, very tip. So if the toothbrush becomes splayed or like a fan, the tips are no longer effective in cleaning the teeth. So it's very important that they be changed. If a person lives in a group home, never put the brushes into the sink for cleaning at the same time. Clean the brushes one at a time. Have disposable gloves available for the caregiver to wear. Good lighting must be available to see inside the mouth. Personally, those little flashlights that are headbands that are sold at Walmart's or Home Depot or Lowe's work really good in allowing you to have light where you need it and when you need it. Just make sure that the light's not shining on the individual's eyes. So adjust it, and this will make it possible for you to see if there's anything that doesn't look normal. The caregiver should maintain a conversation with the individual. Use a tell, show, do dialogue. The brushing experience should be positive and as much fun as possible. Tell the person what's going to happen. Show or demonstrate what you're going to do. Then do or perform the task, like brushing the teeth. This is a time to be creative. You could play music or have a favorite toy available if appropriate. Persons with impaired senses may feel some reassurance if you let them smell or taste the toothbrush, feel the toothbrush, or hear the sound of the mechanical or electric brush. Be positive and reward good behavior with compliments. If the person's resistant, be patient. In the beginning, keep the oral hygiene sessions short and increase the duration as the person adjusts to the process. There's a lot of great music videos out on YouTube or on the internet They go along with brushing their teeth. So sometimes these used as a routine will become a positive experience. Always encourage the individual to try to brush by themselves. This gives them some sense of independence. Progress to hand-over-hand technique when needed. If necessary, check to see how well the individual brushed their teeth and rebrush the teeth yourself if needed. Those disclosing tablets or solutions that are available over the counter work great. They're either chewed, wiped on, or rinsed, and then the plaque is stained either red or blue or purple depending on the individual product. It makes it a lot easier for you and for them to see where plaque has remained and then brush it off. Toothbrushing is not complicated. What's important is not to miss any surface of the tooth. Brushing, especially at the gum line. So when you start brushing, make sure that you brush the gum line. Tickle the gums. It's like what I tell the kids. Tickle the gums, brush the molars, and then wiggle the toothbrush on all the teeth. When your assistance is needed, the key to success is being able to see what you're doing so that you don't miss anything. Also, so that you can know if something looks out of place or not normal. A chip in a tooth, maybe a little pimple beside the tooth, a fistula that may indicate an abscess or an infection. So remember those headlights that I talked about from the Home Depot, Lowe's, Walmart. They work really, really well. Wash your hands and wear disposable gloves. Latex-free gloves are preferred. Use a small amount of toothpaste. If the person's at risk of breathing in objects, just moisten the brush with water or mouthwash. The physical removal of the plaque is what's most important. Remember that all surfaces of the teeth must be brushed. Always aim the bristles of the brush at a 45-degree angle towards the gum line where the teeth and the gums meet. There's a little space there, what we call the pocket. And we want the bristles to actually go into that pocket and remove the bacteria and the plaque that's stuck in there or hiding in there. And you'll see an illustration of this in the video segment that we'll show to review this. Starting with the upper teeth, brush all the outer surfaces, then the inner surfaces, and then the chewing or biting surfaces. When completed, proceed to the lower teeth. Then brush the tongue or use a tongue scraper. If the tongue appears gray, green, or gray-brown color, tongue cleaning is absolutely necessary. In my mind, it's necessary pretty much every day. Brush the tongue or use the special tongue cleaners to remove the leftover food or other material that collects around the taste buds on the tongue. Don't forget to check for any unusual changes, abnormal appearance after the mouth is clean and rinsed with water. Remember that cleaning the tongue is very, very important. The germs that accumulate there can cause bad breath and infection. Here's some example of tongue scrapers. And they're very good. They can be found in drugstores, Walmart, Target, most places nowadays. When brushing the tongue or scraping the tongue, always brush or scrape from the back of the tongue to the front. It takes a few passes to completely clean the tongue. Remember, the tongue scraper causes less gagging. If you want to see the plaque easier, this is an example of those disclosing solutions or tablets that I was talking about. The plaque is stained a bright color, and you simply go back in where you missed and remove the rest of the plaque. You can also use it before brushing instead of after you brushed and then go back. They're available as non-prescription, over-the-counter items at most pharmacies. The tablets are chewed, the liquid is swished, and then spit out. Or you could just wipe it off with a cotton tip applicator. What remains is the stained plaque showing the areas that need to be brushed better. The video segment that we're going to watch today was developed by the University of Nebraska College of Dentistry. The video segment talks about children with special health care needs, and children are featured in the video segments, but these techniques that are shown apply to caring for adults as well.
I'm Dr. Brandy Raber.
And I'm Dr. Shiri Uchida. This program will include oral hygiene techniques, the use of alternate positions, and adaptive aids. Please remember that this educational training program does not take the place of routine visits to the dentist.
Unfortunately, daily oral hygiene can be a challenge for children with special healthcare needs and their caregivers. Some children with disabilities may be capable of cleaning their own teeth, whereas other children may find it physically and/or mentally difficult or impossible to do so independently.
In these cases, a caregiver needs to provide some assistance. The child should be encouraged to brush by himself or herself first, with the caregiver providing follow-up care. The following segment will demonstrate how a mother allows her daughter to first brush her teeth independently and then assist in cleaning her teeth thoroughly.
On 11, circle. Circle. Does that feel good?
Yeah.
Okay, go on this side. You're using too much toothpaste. You only need a little bit. Okay. Okay, now let's get the inside of your teeth. Inside, go in circles. Right there. In circles. Does that tickle? Yeah. Okay, and now up top on the inside. Turn your brush in. You can get the roof. Feel that? Does that tickle? See how you get back there?
Consider the cognitive level of the child with special needs when it comes to their ability to effectively brush their own teeth. Some may be able to hold the toothbrush while others may not. If the child is able to hold their own toothbrush, you should allow them to do so. Letting the child be involved in the activity of brushing may be more enjoyable for them. Always remember to help the child brush or to follow up after they have brushed to evaluate the results. Be ready to help in brushing to ensure that all of the teeth and tongue were cleaned properly.
Cleaning the tongue is a major factor in oral hygiene. Tongue cleaning is always advocated, but if the tongue appears gray-green or gray-brown, tongue cleaning is absolutely necessary. In order to properly clean the tongue, one can either use a toothbrush, tongue scraper, or tongue brush. Brush the tongue or use special tongue cleaners to remove the debris that collects around the taste buds on the tongue. Scraping the top surface of the tongue once or twice daily, after breakfast and just before bedtime, is suggested to reduce the microorganisms in the mouth. When cleaning the tongue, use long, deliberate motions down the top surface of the tongue.
Say, ah, ah. Oh, look at how nice that works, Donnie.
Good.
Good job. Okay, one more time. One more time. Say, ah. One more time. Get all that icky stuff off. We try it one more time.
That's good.
Go ahead and cough. One more time. Come on. All right.
Very good.
Good job, Donnie. All right. Nice and clean.
Always wash your hands before helping a patient brush or floss. You may use disposable gloves if you choose to, but be aware if they have a latex allergy. If so, use nitrile gloves instead. Children who have spina bifida or who have had multiple surgeries may be at higher risk for having a latex allergy.
A pre-brush tinting rinse used before brushing would also help in identifying areas where attention is needed. The rinse may be brushed or swabbed onto the teeth to show you where the plaque is so that you can better clean the child's mouth. Remember to continue to brush until all of the dye is removed. You may have to brush multiple times to remove all of the plaque. After brushing, you may wipe the teeth and mouth with a towel to evaluate what areas still need to be cleaned.
I'm working with the dentist today, working on Andrew. I learned a more efficient way of brushing Andrew's teeth by brushing up there near the gum line, and to wipe it down afterwards with a gauze pad. I hope to see this video in the future so I can learn new techniques and ways to take care of Andrew's teeth.
Electric toothbrushes may be very helpful. You may need to desensitize the patient by first allowing them to feel the vibration on their hand, then on their cheek, lips, and eventually on their teeth. The sound of the electric toothbrush might also be startling to the patient. Introduce the toothbrush and other objects slowly. Hyperactive gag reflexes are common in children with minimal oral stimulation. If your child has a hyperactive gag reflex, avoid laying them on their back. Keep them sitting up if possible. Minimize the amount of toothpaste used and take frequent breaks.
Let's talk about how to make home care easier for you and the person you're caring for. We could do some adapting of toothbrushes. Many people with developmental disabilities have difficulty coordinating their hand movements. Sometimes they're not able to grasp the handle of the toothbrush. If the person requires a large item to grasp, make a hole in a tennis ball and stick the handle of the toothbrush into the hole. The ball can then be held, and this might help the person with their brushing. Tennis grip or tape may be also wrapped around the toothbrush handle to make the handle thicker. Some individuals will benefit from multi-surface toothbrushes. These brush the three surfaces of the teeth at one time, and less dexterity is needed to use this type of brush. For persons with severe risk of breathing in objects, there's a plat-vac toothbrush which attaches to a portable suction machine and withdraws the oral fluids while the teeth are being brushed before the fluid can be breathed in. Mechanical or power or electric toothbrushes can be very helpful and can increase brushing efficiency, especially the sonic toothbrushes. They can clean further than the end of the bristles. They may not be appropriate for individuals who are bothered by strange sounds or unusual sensation, but if you take your time and have a lot of patience, do the show, do tell technique, and have the patient adjust to the sensation and the sound, this can also be very beneficial. The increased noise and vibration might be disturbing, but if you are able to overcome it, you'll have great success in cleaning the teeth. It's really important to position yourself properly. If possible, the person should be seated for toothbrushing. The caregiver should stand behind the person. Kind of like when you go to a dental office, the dentist usually sits behind you. It makes it easier to access the mouth and to see. Sometimes when brushing, it helps if the caregiver leans against a wall for support. The caregiver should support and cradle the person's head while tipping the head backward to view inside the mouth more easily. If the caregiver is right-handed, the head should be cradled with the left arm, and vice versa if the caregiver is left-handed. These pictures demonstrate different positions that can be used when brushing the teeth of a person with a physical limitation. Notice that one caregiver uses the right-handed brushing and the other is using the left-handed approach. Sometimes it may take two caregivers to manage the hyperactive individual, one to reduce the energetic or exaggerated physical movements while the other focuses on the brushing technique. You can't always do it by yourself, otherwise you could both get hurt. There are differences of opinion about the use of restraints or methods of securing a hyperactive person as a safety measure to prevent injury to the person, not as a punishment for the convenience of the caregiver, dental provider, or staff. We won't be discussing this subject right now, and this is something that you need to discuss with your dental provider. In order to perform better oral health care, discuss it with him or with her. Sometimes it's necessary to help a person who's incapable of keeping his or her mouth open. It can be helpful to use a cushioned mouth props, as shown here. Care must be taken not to injure the person that you're trying to help. Be aware of any loose teeth and try to avoid them. Apply downward pressure to the lower jaw to get the initial opening of the mouth. The foam bite stick should be introduced horizontally and then rotated 90 degrees so that the mouth is open and the individual has something to bite on and rest on. This foam stick's available from a company called Open Wide, and it's one of a kind. This is excellent. It doesn't disintegrate in the mouth. Doesn't tear apart easily. Otherwise, you could use tongue depressors that are taped together, that these need to be cleaned thoroughly or disposed off each time, or a rolled up or moistened washcloth. We're not going to watch a video on positioning, but it's really important to realize that you should discuss the transferring into other techniques with your dental provider. These can be individualized.
Individuals who cannot hold a toothbrush, you can modify it to better fit the child. A wide elastic rubber band wrapped around the hand and brush can help keep it in place. Make sure the band isn't too tight. A Velcro strap used to hold food utensils can also be used to hold a toothbrush. The Velcro strap is fastened around the hand and has a handle that is more easily gripped by the child. After the strap is in place and the child is holding onto the handle, the toothbrush may be placed into the slot on the top. Again, allow the child to brush first, but reevaluate the progress and be ready to assist the child in brushing. You can also cut a small slit in the side of a tennis ball and slide it onto the handle of the toothbrush. Or place the end of the toothbrush in a round ball similar to a tennis ball. The ball on the end of the toothbrush helps the child hold the toothbrush if their gripping skills are not adequate. Other types of handles may be used as well. If the patient has limited arm movement, you can add a ruler or a large spoon to the end of the toothbrush to lengthen the toothbrush and allow the patient to brush without needing the arm to flex into the proper position. Be creative when designing a handle for your child. Tape may be used to build up the handle, or try using a handle from a bicycle. Toothbrushes created for infants and small children may be used as well. They have an easy grip circle handle so the child can hold the toothbrush like a toy and facilitate their brushing. Remember that after the child brushes their teeth, to follow up and ensure the mouth is adequately cleaned. It is important to use fluoridated toothpaste whenever possible to help protect the teeth against dental caries or cavities. If you are able to use toothpaste, you only need a small pea-sized amount for older children who can spit, and a smaller smear amount for younger children who can't. You can wipe the toothpaste off of the teeth after you are done brushing with a towel or gauze. If the child cannot tolerate the flavor or scent of the toothpaste, you may brush with water or use a sponge applicator to apply a fluoride rinse instead. You can also use an antibacterial mouthwash such as prescription Paradex to aid in cleansing the oral cavity. Consult your child's dentist to determine if a prescription mouth rinse such as Paradex is recommended.
If you need to brush for your child, make sure you choose a time when your child is not fussy or tired. Choose a comfortable location with plenty of space, such as in the bathroom, in the kitchen, or dining room. No matter what location you choose, make sure you have good lighting and try to keep the light out of the child's eyes. When brushing another person's teeth, positioning of that person is the key to success. There are many different positions that may facilitate brushing. Try several different positions to see what is most comfortable for both you and your child. If your child is in a wheelchair, you can either brush their teeth while they stay in their wheelchair, or you may decide to transfer them to a different location. If the child is staying in the wheelchair, it may be beneficial to tilt the wheelchair back. Make sure the wheels are locked before brushing their teeth. After tilting the wheelchair, you can decide if it will be easier to sit in a chair behind the wheelchair or stand behind the wheelchair. You may need to support the child's head while standing behind them. If you decide to relocate the child, a variety of positions or devices can be used. Beanbags provide a very easy, comfortable way to support the child while you are brushing. Another variation is to have the child lay on the bed, floor, or sofa with his or her head on your lap. 2 people may be needed to transfer the child to the floor and ensure that he or she is positioned comfortably. A pillow or blanket can be placed behind the knees or legs for added comfort or support. A pillow can also be placed behind the child's back when lying on the floor. The second caregiver can hold the child's hands or legs if needed. Another position is placing the child in a chair and standing behind them. Brush their teeth with one hand while supporting their head with your other arm. Also, keep a logbook of what works and what doesn't work. This will help you and your dentist determine the best way to provide oral health care for your child.
Flossing removes the plaque that's caught between the teeth where the toothbrush can't reach. The toothbrush can't go in between the teeth or through the contacts. Remember that when you're guiding the floss between the teeth, the floss should pass fully through the contact between the teeth that touch each other. The floss should be guided against the tooth in front and then the tooth behind before removing, either by working the floss back and forth and out between the teeth or pulling it out from one side. It's difficult to do this. You can use a floss holder in many instances. There's different kinds. There's the disposable kind that already comes sometimes with even shapes of animals. Or there's the reusable kind where you wrap a new fresh piece of floss every time you use it. If you feel uncomfortable using dental floss and flossing as described in the last slide, you might consider the use of a motorized flossing device. There's a few of them out in the market, and you don't have to stick your fingers directly into the mouth, and it increases accessibility. Basically, your fingers will stay outside of the mouth. You'll see an example of these items in the video that follows. Now let's watch a video on flossing.
Flossing is also an important component to oral hygiene. It takes a lot of practice and may be difficult at first, but will greatly improve your child's oral health. Any type of floss, waxed, unwaxed, flavored, or plain, will all do the same thing. Pick which type works best for you and your child. Flossers may be used to help the caregiver reach teeth in the back that may be difficult to reach otherwise. There are several other devices created to help aid in flossing as well. Flossing is essential to cleaning in between the teeth where the toothbrush cannot reach. Gum interproximal brushes work well if there are small spaces between the teeth. These interproximal brushes also stimulate the gum tissue for better gingival health and may be particularly helpful in children who do not eat through their mouth, but rather through a G-tube. Children who have soft diets or who do not eat through their mouths do not get proper gingival stimulation to produce saliva and other self-cleansing mechanisms of the mouth. Some tongue scrapers have a toothpick at the opposite end that can be used to clean in between teeth. The hummingbird is also a useful tool in a child who likes to brush on her own and wants to floss but maybe does not have the dexterity to floss by him or herself. The hummingbird has 2 different attachments. Both attachments will vibrate when the button is pushed. This vibration further helps clean and stimulate the gum tissue. The first attachment is a pick type attachment, which may be placed near the gums between the teeth.
If you are experiencing difficulty in keeping your child's mouth open to brush or floss, you may choose to use a foam bite stick. The bite stick is soft and comfortable for the patient, yet strong enough to endure the biting forces and allow you to keep their mouth open while you brush or floss. If you do not have a bite stick, be creative. You could use a sterilized rubber doorstop or roll up a washcloth and wet one end of it. Children tolerate the washcloth very well, and again, it allows you to see inside the mouth of a child who may not open otherwise.
Whenever applicable, give positive feedback to reinforce good behavior. You may reward your child with small prizes like stickers to encourage positive behavior. You can allow your child to hold their favorite toy to comfort them, or use music or movies to help distract your child while you clean their teeth.
Have a routine for dental care. Use the same technique at the same time and place every day. Many people with developmental disabilities accept dental care when it's familiar. A routine might soothe fears or help eliminate problem behavior.
Take time to check your child's mouth once a month for any problems. Tell the dentist if you notice that the gums are sore, swollen, or bleeding, if the mouth appears to be dry or has white patches, or if you see any other problems.
Make sure you know what to do in case of an emergency for accidents involving oral trauma, and be sure to notify the dentist.
Most importantly, Keep regular dental checkups for your child. Remember, a healthy mouth helps to maintain a healthy body and a good self-image.
Individuals with special needs deserve our best efforts in keeping their smiles safe and beautiful. Making a difference in their oral health may be slow at first, but determination and patience can bring positive results and invaluable rewards.
By adopting the strategies discussed in this video and maintaining good oral hygiene, you can have a significant impact on your child's oral health and quality of life.
The dentist or hygienist may recommend a special mouth rinse that can kill bacteria for your patient, or a fluoride rinse. Mouth rinses that fight bacteria may be recommended in order to help prevent or treat periodontal disease. Fluoride rinses are usually useful in preventing tooth decay or dental caries. They remineralize or put back some of the mineral that has been removed from the tooth or the enamel surface of the tooth by the acid. Both of these kinds of rinses should be spit out after rinsing and not swallowed. For people with swallowing difficulties, these rinses can be applied to the tooth surface with a cotton swab, a dampened gauze, or a toothbrush dipped in the solution. Individuals with cerebral palsy may have an exaggerated gag response. It's best to carefully explain what you're doing and what they need to do. Some of the examples of things that you might want to suggest or try is to have the patient place his or her chin in a neutral or downward position instead of backwards. Use a sitting position, not having them laid back as far. Using a toothbrush with a small or compact head. The less material or things that are in the mouth, the less the likelihood of gagging. And also using a minimal amount of toothpaste. If the patient's unable to use toothpaste, then it would be best to dip the toothbrush in a rinse so that you don't have to introduce a lot of the pasty toothpaste or gel in the mouth. So remember to use the tell, show, and do method. A suggestion of what you might tell a potential gagger would go something like this. I'm going to be brushing your teeth. It's easy. You'll be fine. This is your toothbrush, and we'll start on your front teeth so that you can get used to what we're doing. I'll give you plenty of time to catch your breath so that you'll be comfortable. If you have to, you can raise your hand and I'll stop. This reduces the anxiety and allows the person to gain confidence and somewhat to gain some control. All dentures must be cleaned after every meal. You have to remove them from the mouth and scrub them gently with a toothbrush or toothpaste. This should be done over a sink with a washcloth or paper towel placed under the basin of the sink to prevent damage to the dentures if they're dropped while cleaning. Each night, the denture should be removed, cleaned, and placed in a clean denture cup with a small amount of water and sometimes a rinse in it, whether it's something like Listerine or a special denture cleanser. And these can be bought over the counters. The denture should never be wrapped in a tissue or paper towel when they're out of the mouth because they can accidentally be thrown away, and it's very difficult and costly to replace them. Remember, the patient should not sleep with dentures in the mouth. It's kind of like wearing a hat all the time. You need to have oxygen and saliva touching that tissue, and the plastic of the denture prevents that during the day. Let's talk about when you should ensure that a person gets to a dentist right away or if it can wait. Just because a person has a developmental disability, it doesn't mean he or she doesn't feel pain. So some conditions are going to require immediate attention within 24 hours by a dentist. You want to make sure that if the person can't communicate verbally, you can identify some of the signs of pain. If there's tooth or mouth pains, like from trauma or accidental injuries, self-inflicted injuries, or an abscessed tooth, these conditions need to be treated immediately. When there's bleeding from a tooth, the tooth is hypersensitive or very tender to biting pressure or to cold, or when the tooth has suddenly displaced or moved out of alignment. These are all cues that something needs to be done. Here's some conditions that require immediate attention. Swelling. Swelling of the gums, the lip, the tongue, and the face may result from an injury or an infection. Swelling that's accompanied by an elevated temperature or a fever may signal an infection. Such infections and facial swelling, especially in the lower jaw region, can be serious and can jeopardize breathing. These demand attention right away. Swelling may also indicate an immediate allergic reaction and likewise needs to be treated immediately. Swelling or pain without a fever may signal a facial injury or a fracture. Bleeding. Heavy bleeding from the mouth, which doesn't stop by itself, could be caused by an injury. You may not be able to see the source of the bleeding, especially when there's a lot of bleeding and mixed in with the saliva. When bringing the person to a health provider to be examined, the person should be positioned as upright as possible to minimize blocking of the airway by the blood. An avulsion, which is when a tooth is knocked out of its socket with the root attached, needs to be treated right away. If the tooth accidentally comes out, root and all, as a result of an injury or fall, make sure that you locate that tooth. What's really important is to realize that you don't want to scrape it clean. What you want to do is, if it's really, really dirty, you want to just maybe rinse it with a little bit of water without scrubbing it and place it back in the socket, especially if someone can be holding it in for the individual or the individual can hold it in for themselves. If that's not possible, then you can place it in some sort of liquid, milk or water, and bring it to the dentist along with the patient right away. The best chance of replacing it into the socket, if it's done quickly, within about an hour of coming out, that's the most likelihood of it being able to be reimplanted. The goal is to keep the tooth moist, because if the root's allowed to dry out, there's no hope for replacing it in the socket. So remember, do not scrape it, even if it's full of dirt. We can treat anything from the bacteria in the dirt, but if you scrape it and you kill the cells on the root, then you're not able to reimplant it. So the caregiver must always be aware of facial changes in the individual that they care for. Now here's some non-emergency conditions that require attention, ideally within 48 to 72 hours. These are examples of situations that may be examined by a dentist, but that do not require emergency attention within 24 hours unless there's pain or heavy bleeding present along with it. So bleeding gums, enlarged or overgrown gums, mouth sores such as aphthous ulcers or cold sores like the herpes virus, white sores surrounded by a red raised edge on the cheeks or gums, cavities appearing as brownish areas on the tooth surfaces, fractured or broken teeth with or without cavities, discolored teeth, either gray or pink, pain or sensitivity from age-related gum tissue loss, improper brushing technique or using too much force, eruption of wisdom teeth, and canker sores. Some other non-emergency conditions that require attention include oral yeast infections or a whitish coating or patches on the tongue, roof of mouth, or cheeks. This may follow the long-term use of, or even sometimes short-term use of antibiotic medicines. The other example is the hairy tongue. This is when the elevated pads on the surface of the tongue have become long and may be colored black or white or brown, sometimes even green or orange from Cheetos or from the food that's being eaten. And this is actually due to bacteria piling up one on top of the other and forming kind of like hairs on the surface of the tongue. This is more likely to occur on mouth breathers, or those with poor oral hygiene, or those that take a lot of medicine. But remember, this is why using a tongue scraper every day is so important. This can be prevented if you can't keep the tongue clean. So it should always be clean at the same time that you're brushing the teeth. Another example is a gum boil or fistula. It's a pimple-like opening on the gums near a swelling of the gums above or below the teeth. This occurs when there's a chronic, long-term, untreated tooth infection. It usually does not cause pain because there's drainage of the pus and the pressure doesn't build up. If the pressure builds up and there's no draining occurring, then the patient might experience pain. Sometimes that draining of the pus causes a bad odor or taste in the person's mouth. This is why it's important to lift the lips, move the lips out of the way so that you could see in that area and see if there's something that doesn't look normal. Another thing to look for are broken teeth. They require attention, but usually not as an emergency, as long as there's no bleeding or pain that's coming from the tooth. So if the tooth chips and you see pink, there's sensitivity to cold, even breathing in air, that requires immediate attention. If the tooth chips and it's only a small chip, there won't be that much pain associated with it. It can wait it could wait 48 hours, 72 hours. It doesn't need to be within 24 hours. When teeth are injured from a fall or a serious hit to the mouth, they may become discolored. This discoloration from a recent injury may appear either pinkish or reddish due to bleeding inside the tooth. But in older injuries, they appear more as a gray or brown color change to the tooth. And this is due to the breakdown of the blood and the pulp tissue, the nerve tissue, the tissue that's inside the tooth that makes it alive. So it's kind of like a bruise in the skin that appears blue and then black. So this means when it's turned this grayish or brown color, is that pretty much the tooth is dead and it needs to be treated. The treatment for these situations usually requires a root canal treatment, and if that's not possible, then extraction of the tooth may become necessary. Let's talk for a few moments about replacing missing teeth or using dentures. There's several ways to replace missing teeth. The individual needs and the ability of the person to participate sufficiently to permit dentures to be made may determine whether or not teeth can be replaced. There's also financial considerations to take into account. The picture on the left shows a complete upper and a complete lower denture. A complete denture replaces all the teeth in the upper or lower or both arches. The picture on the right shows a lower partial denture. A partial denture may be designed to replace some missing teeth in most places in the mouth. It may be on the top or bottom jaws or both. Many persons with poor muscle control of the mouth and face are unable to keep a denture in place because it involves a coordinated movement of the muscles of the cheek and the tongue. For example, this might be seen in a person with cerebral palsy or a stroke resulting in facial weakness. Another way that dentures are held in place is by a thin film of saliva. The saliva in the mouth acts as a lubricant film that provides some suctions for the dentures to stick to the soft tissue in the mouth. Many medicines that cause dry mouth interfere with this kind of suction, keeping the denture from being as stable or comfortable as it might be with an adequate salivary flow. Persons who lack the capacity to understand the purpose of the dentures may constantly remove them, resulting in either damage or loss of the dentures. This is often seen in persons with intellectual delay, Alzheimer's disease, or other cognitive impairment. Many persons with diminished manual dexterity may require assistance in both placing and removing the dentures. Many older persons, such as those with osteoarthritis or have had a stroke, or individuals with cerebral palsy resulting in muscle weakness, reduced control of muscle movements, muscle contractions, and exaggerated reflex or continuing contractions of the hand may have difficulty as well. Now let's talk about creating a dental home and preparing for the visits to the dentist. Selecting a dental home or creating a dental home is the process of establishing a relationship with a dental health care professional who can provide ongoing and regular care, not just emergency care. He or she is able to meet the treatment needs of the individual and offer continuity of care. The dentist should have some experience with special needs individual or the willingness at least to attempt treatment. Asking a pediatrician or physician for referral might be a good starting place to finding a home dental provider. Referrals can also come from families or other group homes that have had positive experience with a particular dental provider. Remember that the first dental visit should begin after the first tooth erupts and no later than 1 year of age. This is very important. There's a lot of things that can be done preventively, such as providing fluoride varnish on a regular basis that will increase the resistance of the teeth to caries, so making them less likely to get cavities. It's also a good time to really meet the dental professional provider and make sure that the caregiver understands what are the best procedures to perform in order to keep the patient healthy. A pediatric dentist usually treats children until the 18th birthday. For special need individuals, sometimes, depending on the person, the pediatric dentist may continue to provide treatment beyond the age of 18. However, in many cases, the person with disability will be transferred for continuing care to a general dentist for adults. This is where it becomes very important to find the right professional. The pediatric dentist might be able to provide a referral to the general dentist or the hygienist who's willing and able to handle the special needs of the individual. Preparation is key to a successful dental visit. It's important to explain in advance what the person should expect. The person should be told what he or she should expect to happen in a way that they could understand it. Some people respond to picture explanations better than to words. Photos of the dental office, the waiting room, the front desk staff, dentists, dental assistants, and the treatment room may help show the individual what to expect. There's also videos, cartoons available that explain a dental visit and what to expect in a dental visit. The caregiver who brings the individual to the dental visit should have a list of past and current illnesses and medicine that the individual currently takes, including dosages for what reasons the drugs are taken. A list of previous surgeries and known allergies should also accompany the individual, as well as a record of past dental treatment if available. Preparation is really a key to a successful dental visit. So the legal guardian should be available to sign important papers such as consent for treatment. You don't want to go all the way to the dental office and then not have things ready and have to reschedule. Special transportation should be arranged for, and the dental office should be informed of how the person will be arriving and leaving. The person who accompanies the individual should be knowledgeable about him or her. It's really important that they're able to really know if the person is getting anxious, is experiencing pain from visual cues, and usually if the person that accompanies them is somebody that they're used to, the visit will go a lot smoother. So therefore, the person who accompanies the individual should work with him or her regularly and knows their routines and their ways of expressing pain. The knowledgeable caregiver is able to express when the person has reached his or her limit for treatment based on their behavioral changes. The caregiver should also know the likes and dislikes of the individual, and this can help put them at ease and help the dentist or hygienist during the visit. For the first dental visit, if it's possible, try to get a get acquainted appointment. This can be helpful for the person to get adjusted to the dental environment. The first visit may mean coming to the office to familiarize the individual with receiving any treatment. This can mean something as simple as getting to see how the chair goes up and down, the noises that will be associated with the visit, testing out the suction, spraying the water. Some individuals behave better in the morning before the stresses of the day happens. Others do better if they're allowed to attend a familiar and beloved program or activity before going to see the dentist. So this is an individual preference. Leaving the program for a dental visit early may mean less of a sacrifice than missing the program completely. So take these things into account if it's possible to work it out with the dental office. Not always will the timing be perfect. The caregiver should be able to explain the individual's physical limitation to the dental provider, such as maybe telling the dentist that there's a risk of breathing objects into the windpipe, also known as aspiration, or the suggestions for transferring them from the wheelchair into the dental chair to make it smoother and less likely for any discomfort. The presence of any tubes that are attached to the person that aid in feeding or to help drain fluids needs to be communicated with the dental office. The caregiver should be able to explain the individual's main methods of communication, such as whether it's speech, sign language, a storyboard, or any other special communication styles. All concerns about the dental treatment should be discussed with the dentist or hygienist whenever they arise. The caregiver should discuss any signs of the person's tolerance levels, including usual signs of tiring or discomfort. Just as we have discussed previously, be certain that your oral health professional is aware of any of the concern that you have regarding the individual's treatment. Conscious sedation. This can be done to help relax a disturbed or an agitated person who may be unable to allow dental treatment to proceed. This will be depending on the disability of the individual, the level of cooperation of the individual, behavioral non-cooperation, or experience of the dental practitioner. A calming sedative or medicine may be necessary to perform the procedures and accomplish the treatment needed safely. A sedative might be given by either the mouth, the nose, injected into a muscle, like intramuscularly, or injected into a vein, IV, intravenously. Sedation is a chemical restraint and shouldn't ever be prescribed for the practitioner's or the dentist's convenience. It should be only prescribed when it's necessary for treatment. Working with individuals to improve behavior by teaching them how to be good partners in their own oral health care will benefit them in the future. If sedation is not effective to provide dental treatment, it may be necessary to put the individual to sleep in a hospital operating room with general anesthesia that's given by an anesthesiologist. So in conclusion, special needs individuals rely on our help to ensure that their smiles stay healthy and beautiful. Making a difference in their oral health may be slow at first, but if you have determination and patience, this can bring about a positive result that's beneficial for both you and the individual. By adopting the strategies discussed in this presentation and maintaining good oral hygiene, you can have a significant impact on the oral health and quality of life for a person with special health care needs. Here are some websites where you can find more information. Now, let's watch a video that illustrates various types of oral hygiene aids that we have talked about during this presentation.
In this portion of the program, we will review various products and techniques for cleaning your child's mouth. Shown here are some of the products that can be used and that will be demonstrated later on models. They include various types of toothbrushes, tongue scrapers, flossers, and mouth props. Shown here are the models and toothbrushes we will be using to demonstrate some oral hygiene techniques and products.
In this model shows the primary dentition or baby teeth. And if you see on the side, you can see the developing permanent teeth below. This model shows mixed dentition, combination of baby teeth and permanent teeth. You can see in the front the eruption of the permanent incisors. And on the side, the permanent teeth developing below the baby teeth as well. This model shows permanent dentition. With most of the permanent teeth erupted in the front, with a few permanent teeth still being developed and will be erupting soon below the primary teeth. First, start systematically, one side of the mouth like this, and brush the outside surface of the teeth first, and then go to the biting surfaces of the teeth, and then also the inside surface of the teeth. And as far as the bottom, you do the same. Start on the outside cheek surface of the teeth, and then the biting surface of the teeth, and then the tongue side of the teeth. And this model has a tongue, which you can use a toothbrush to brush the tongue. You can use the bristle portion of the tongue scraper, or you can turn it around and use the other side as well. This is another tongue scraper that has small teeth on one side, which you can use to clean the surface of the tongue, and you can also use the other side as well. To keep the patient's mouth open while brushing, first place the bite stick in a horizontal position into the mouth, and then turn it vertically and keep it towards the back of the mouth so that patient can bite down on the bite stick. Press the button to turn it on. Start on the cheek side, and then go to the biting surfaces of the teeth, and also get the inside surface of the teeth. This is a 3-headed toothbrush that allows you to brush all the surfaces of the teeth at once. So as you can see, it's brushing the cheek side or outer side of the teeth, the biting surface, and the inside surface of the teeth at once. So for patients that have a difficult time keeping their mouth open long enough to brush, this is a good toothbrush to use.
You can modify a toothbrush handle for patients who have difficulty with holding the toothbrush. After creating a toothbrush handle to better fit your child, use it in the same manner as you would a regular or electric toothbrush.
This is another example of a modified toothbrush with the handle allowing the patient or caregiver to grab the handle, brush the teeth in the same way as you would a regular toothbrush, getting the cheek surface, the biting surface, and the inside surface of the teeth. This modified toothbrush can also be used to clean the surface of the tongue like this. Start from back to front. And this will help remove any bacteria or food on the tongue surface. This is an example of a tongue scraper with a pick at the other end that can be used to clean in between the teeth and gums. What you would want to do is go ahead and insert the toothpick between the teeth. This will help remove any food or plaque that is between the teeth and gums.
This flosser has a pick on one side and floss on the other. The pick side can be used to clean near the gum line and stimulate gingival tissue. The floss side is used to clean in between the teeth where the teeth touch. Gum interproximal brushes are small, soft brushes. Use slow in and out motions to clean between the teeth and massage the gums.
You want to use dental floss to clean between the teeth. Wrap the floss around your middle fingers like this and use your pointer finger to manipulate the floss around the teeth. So you want to go ahead and floss between the teeth like this. This is the hummingbird that has different attachments. One is a flosser and one is a toothpick. This will help clean between the teeth and massage the gums. First, we'll demonstrate the flosser. Place it onto the hummingbird like this. And there's a button on the back. And when you press it, it vibrates and will help dislodge any bacteria or food between the teeth. So what you would want to do is go ahead and place the attachment between the teeth and then hold onto the button while you floss between the teeth. This will allow the food to be removed between the teeth and also massage the gums at the same time. Pull the attachment off. Place the toothpick attachment into the hole and you turn it on the same way. Place it in between the teeth and then press the button. This is a water pick, which is a power flosser. It has a button in the back that when you press it, it vibrates the attachment. Go ahead and place this in between the teeth like this and press the button at the same time.
We have covered a number of products that may be used for oral hygiene purposes. Remember to choose a product that is best for you and your child. Also, be patient when starting an oral hygiene regimen, and with time, you and your child will create a routine that works for both of you.